Have you ever started microsclerotherapy treatment with high hopes, only to have those high hopes pushed sideways a few days later? Don't worry, it happens to the best of us, but these beginner mistakes are completely avoidable, and I'm here to help you learn from mine. Microsclerotherapy might look easy. In fact, it looks deceptively simple. Simply inject those veins, right? But when you're new, there are little things that can trip you up and sabotage your results, and they leave you feeling frustrated. Let's break down those pitfalls so you can confidently provide treatments for your first few microsclerotherapy patients. I'm going to share 7 common beginner mistakes and the simple ways to fix them. Think of it as your microsclerotherapy cheat sheet to avoid newbie errors and get great results for your patients having microsclerotherapy leg spider vein treatment. Let's start with a step-by-step approach. Mistake number 1, the overpromise trap. It's easy to get carried away and caught up in the excitement of your first few patients and tell them that their spider veins will vanish completely. But even the best microsclerotherapy treatment isn't magic. So, be realistic and upfront. Say things like, most people see a huge improvement in the appearance of their spider veins, or the goal is to make them significantly less noticeable. Use terms like improve, clear, fade. This sets the right expectations and makes for a happier patient in the end. Believe me. Mistake number 2, choosing patients without a very specific selection process. Microsclerotherapy works best for certain people. It doesn't work for everybody. Overall, about 80 to 90% of people are pleased or very pleased with the results. About 10% are disappointed, and a small number, probably less than 5%, you actually will make the veins look worse, or so your patients will say they look worse. If you treat someone with hidden health problems, or who've had bad reactions to sclerosant in the past, it doesn't matter how careful and meticulous the injections that you provide, the healing process will be compromised. So, the fix here is to be super selective. Ask detailed questions in your medical history. Look for anything concerning, things like the presence of varicose veins, skin changes, and be particularly concerned about any spider veins around the ankle. Spider veins around the ankle often indicate that there's superficial venous reflux, and this might be actually a contraindication to microsclerotherapy, at least in the first instance. And if you're in doubt about whether the patient is suitable, you might say something like, this treatment might not be a best fit for you right now. It's better to have a disappointed patient that you turn away than a patient who's then very angry that they didn't get the result they wanted and they've parted with money. That's not something you want to happen. And if you can form a professional relationship with a more senior colleague in your area, it's a good idea to be able to refer those sorts of patients for a second opinion before you take on microsclerotherapy. Mistake number 3, missing the key targets. Now, the problem is, if you can't see these small spider veins clearly, good luck hitting them with a needle. Forgetting to really map out those spider veins makes accurate injections super difficult. Fix here is to get some simple equipment for your clinic. Things like bright lighting. You might want to use a vein light to see those feeder veins. Anything that helps you see those veins more clearly, then you're going to have a better chance of actually injecting them. These veins are tiny. It's difficult to inject them, so give yourself the best chance by getting some magnification and good lighting. The other problem when you're starting off is that you tend to go overboard with the injections. The problem is that when you do get blanching of the spider veins, it's very exciting. It's a great feeling when you successfully get a needle into a small vein, inject it, and see that blanching and see the vein clearing. And the temptation for beginners in microsclerotherapy is to inject too much solution too quickly and perhaps use a solution that is too strong. for the size of vein that they're treating. Now, this is a recipe for all sorts of problems. It can cause pain and it can cause complications, particularly things like hyperpigmentation, brown staining, and it may also cause little scabs and ulcers. Microsclerotherapy is not about brute force. You don't want to be clearing large areas with your sclerosant. You need a delicate, gentle approach. The fix for this problem is the mantra that I've mentioned so many times: low, slow, low. Inject low volumes of sclerosant, slowly and gently, and use the lowest concentration of sclerosant possible. Listen to your patient for feedback. If they say ouch, or if they flinch, or if they begin to move and you think it might be painful, stop immediately. Pain is a wonderful indication that something's not right. Remember, you're using very fine needles and the sclerosant should be mild. It shouldn't hurt. So if it does hurt, something's wrong. Stop. Mistake number 5, saying goodbye without follow-up. Microsclerotherapy treatment went well. You say goodbye to your patient and you've forgotten to make a follow-up appointment. And this will leave your patient wondering what happens next. They'll go through the healing process, their veins will look worse, and they will be very concerned. So it's really good practice to have a follow-up appointment, and I recommend about the 2-week mark, because that's the time when the veins look worse, usually. You can reassure your patient, and if they have got any trapped blood within the veins, any retained coagulum, then it's a good time to gently evacuate that coagulum by pricking the skin and letting that clot out. That will aid the healing process and it will reduce the chances of any brown discoloration. So follow-up appointments are a good opportunity to provide reassurance. And make sure that you give that appointment before they go so you can look after them and explain the reactions and provide aftercare. It's a good time also for your patient to ask questions, encourage questions, and encourage them to share any concerns that they might have with you. Be proactive in the post-treatment period. And also, before they go, make sure that they know how to contact you if they have any concerns. Either give them your telephone number or your method to contact you by text or by WhatsApp if they're worried about it. Mistake number 6, thinking that faster is better. Now the problem is, at about 2 weeks after treatment, the veins actually are still there. And as I've said before, they may look worse. You may be tempted as a beginner to give another round of injection treatment. And this is absolutely the wrong thing to do. It's far too soon. The fix is to reassure your patients that this is normal and part of the healing process. And you can reassure them that it may take months to resolve. Practicing patience, both on your part and your patient's part, and avoiding overzealous treatment will prevent problems and complications. So it's very important that you educate your patient on the realistic sequence of the healing process and give them the expectation that microsclerotherapy is a marathon, not a sprint. Mistake number 7, forgetting the before and afters. If you don't get before and after photographs, you'll find it very difficult to remember where you started and where you are now. And in fact, your patient will often forget how bad their veins were at the beginning, and they often don't realize the improvement that they've actually achieved so far. So this is a really common blunder, forgetting to get before and after photographs. In the rush to get to the injections, you forget to do the photography. Now, photography is very important, both for medical legal reasons and also for you to be able to reassure your patient about the healing sequence. I remember an anecdote that a colleague shared with me. He said that microsclerotherapy improves the eyesight of your patient, but impairs their memory. And what he meant by that was that patients often forget what their veins were like, and so they don't see the improvement that they've achieved. But on the other side, they then begin to notice veins that they had all along, but they weren't aware of. And there's a possibility they might actually blame you for causing new veins with your treatment. And that might not be the case. You won't know that, nor will your patient, if you don't take good quality before and after photographs. So make sure you include routine photography before you start treatment, and I would suggest at every subsequent visit. So consider this as the guardrails in your microsclerotherapy beginner journey. The 7 things that are crucial to your microsclerotherapy practice. Now, if you're keen on further honing your skills, click on the link in the description box for my free course, How to Inject Spider Veins and Blue Veins by Microsclerotherapy. This resource is packed with actionable tips to refine your microsclerotherapy practice. It contains a video, which you should probably start with. It's also got a manual, and it's got a cheat sheet as a handy reference for you in your beginner microsclerotherapy journey. Remember, everyone starts somewhere. Now, if you enjoyed this, make sure you subscribe for new microsclerotherapy insights, and let's all keep learning together.